Welcome everyone to episode 5 of the Holistic Human Project. I'm your host. My name is Luke. I am the CEO here at AMN Academy. And joining me today is our Director of Education, Dave Fleming. Before we get started in today's episode, I'd just like to offer you the chance to grab some of our education absolutely free. So if you head to our website, www.amn, that's Alpha Mike November, so it's amnacademy.com. That's www.amnacademy.com. You'll see a free resources tab on that page where there's a whole bunch of different options for you to choose from a documentary that we filmed a couple of years ago through to downloadable content, through to articles and tutorials. And if you want to sign up for our email list, there's 2 options there where you can grab some free content, and then also we'll send you a weekly email. So that's 1 email a week on a Monday with new content for the entire year. So it's 52 weeks of free content that you can grab on our website just by joining our mailing list. So head over to the website and take a look around. If there's anything that interests you, we would love to welcome you to the AMN community. So without any further ado, I'm going to get started with today's episode. In today's episode, Dave and I are going to be discussing my rehabilitation from some pretty serious knee surgery that I recently had after a skateboarding accident. I'll get into more details in the episode. But if you are a therapist or a trainer who deals with post-operative care, rehabilitation, etc., this is going to be of great interest to you. We're going to follow this up with a further episode with one of our teaching faculty, Dr. John Campione, in a couple of weeks' time. So keep an eye out for that. Make sure you subscribe wherever you're listening to this podcast so that you grab the next episode when we speak to Dr. John about some of the other things that we're going to talk about post-operative care. So enjoy the episode, and make sure you reach out on social media, Instagram, Facebook, wherever, via email, just to let us know what you thought. And if you have any questions, we always love hearing from our community. So let's get started.
You guys ready? Go!
The Holistic Human Project.
Oh, well, that's interesting.
Exploring how to be healthy in the 21st century.
Oh, you don't say.
Breaking down cutting-edge science into bite-sized bits.
Just how I like it.
And delivering it to you fresh.
Well, Luke, so somewhat recently you suffered a pretty severe injury. I'll let you explain exactly what happened, but it was if you're squeamish, maybe mute at some point throughout this. But Luke suffered a pretty severe injury to his knee, and it's a process through which you have now been through the allopathic model, acute and emergency medical care. You've been through an AMN model, let's say. You've been through a very creative application of your own knowledge in terms of rehabilitation and how to use the nervous system and how to work around some of the things that you're experiencing to try and regain just any movement at your knee, control and everything else. I think it's going to be a really good place for us to, a really good topic for us to discuss, because we can cover a lot of ground and give maybe a lot of advice that people can utilize and apply with their clients or maybe with themselves, and probably relate to this. People are going to relate to this story as well, just who've suffered severe injuries and then, essentially maybe at points been really left on their own with how to deal with these things. So why don't you tell us what happened?
Yeah, cool. So I was skateboarding with my kids. We're at the skate park, and I don't really know exactly what happened. It wasn't anything. I wasn't doing anything spectacular, unfortunately. It just, I think, was kind of the perfect storm of wrong angle or, velocity or something around the joint. But to kind of give it a bit of context, I have had an Achilles rupture on the same leg. Whether or not that was a correlation or a causation, who knows, who really cares? But there was a history of kind of issues on that side, and, throw into the fact that it sort of was preceded by a very kind of 6 months or so of being fairly sedentary, work-related stuff, just being very busy and being at the desk a lot. So I think, combination of I also have genetically kind of found out that I have genetically bad tendons and ligaments, connective tissue. I have a family history of it, and I've had genetic testing, and it's shown up as being an issue. So a whole bunch of reasons, but the end result was that I dislocated the tibia, which apparently is quite rare. So that sort of medially, the tibia kind of dislocated like that. And when the bone came out of the joint, it kind of just cleaned out all of the connective tissue at the same time. So I ruptured the, weirdly, I think maybe because I'm flexible with the history of dance and acrobatics and gymnastics and stuff, weirdly, it didn't take out any of the ACL or any of those kind of internal ligaments. It was the external ligaments and tendons that were affected. So it was the patella tendon was completely ruptured. Again, it was really weird. It ruptured in the middle of the tendon, and not at the sort of at either of the attachment points, which the surgeon said was very strange. He's never seen it before. And he explained it as, imagine sort of fiberglass had exploded. So the sort of fibers were everywhere. It was a big mess, he said. And then the medial collateral ligament, so the ligament on the sort of inside of the knee, was ruptured as well. And there was an issue with the joint capsule too, which required sutures. So pretty serious. The surgeon made a point of telling me every single time that I went in for follow-up that it was the most extreme knee trauma he's ever seen, and he's a knee specialist who specializes in like ice hockey players and stuff. So I think I made his year. Surgeons being the way they are, a little bit weird with that kind of stuff. Instead of kind of looking at it going, oh, poor guy, he was looking at, oh, this was cool. This is so cool. So pretty serious surgical repair. Took about 4 hours of surgery. And as a result, because it was both ligaments, the patella tendon's kind of a tendon-ish and ligament. It's that not really any muscle there, but because it was both of them, they immobilized the joint for 4 weeks, which was rough. And had a lot of atrophy. I think I had about 6 centimeters difference between thigh left and right at the end of it when I got out of the cast. It was pretty gross. Looked pretty gross. So that was kind of the injury and the repair. Obviously, I would have tried to, like, if it hadn't been so severe, I would have tried non-surgical first. But with things like this, there's no other option, if I ever wanted to be able to use that leg again. It was a real eye-opener in terms of, I've had surgery before. That's the first time it's what got me into the health and fitness industry, is because of the lack of information that I was given when I did the Achilles, the misinformation that I was given. That ended up being a career-ending injury at that point, and it didn't need to be. And I was, it took 12 months to rehabilitate. Had I been given the right care, probably would have taken less than 3 months. That sort of got me into this industry initially. And then this one has been another really kind of like eye-opening thing with the information that I was given and stuff. So I think we'll talk today about everything that I've done. And hopefully there's some practical stuff that helps people who might have similar joint injuries.
Well, there's, it's a hell of an injury. I mean, I remember when you first told me explosion description, fiberglass
The fiberglass
explosion in your knee, that really brought it home as to what you'd done. But let's just quickly touch on one of the things I remember you mentioned when this happened. We were communicating obviously about this thing you'd been through and kind of the prognosis you were given and the emotional impact initially that it had. You know, you've done something really, really severe. When you damage the structure of the body, the stuff that holds you together, you really know about it. Even, you know, if you sprain an ankle, it really, really sets you back. You know, but you really know you've hurt yourself. And then what, you know, how the surgeon was describing that you probably never make a full recovery. You're going to walk with a limp. This is going to happen. This is going to happen. And that impacted you. And you also, we talked about genetics. You, as well as maybe having not the best connective tissue in the world from the descriptions we've heard and the genetic testing that's been done, you were also in a high elite level athlete with, you know, what, you 4 or 5 times more likely to be a elite power athlete with some other good
genetic
makeup,
testing.
right? So, you know, every cloud, it's a double-edged sword, but, you know, we can joke, but there was a real impact to how you were spoken to and the information you were given. Just touch on that for a moment. Yeah,
exactly. So I think one of the big things that kind of that made me realize, like, I obviously I tend to look at things from a glass half full perspective. So I was very grateful, and I practice gratitude and meditation, all that kind of stuff. So I was, looking at the things that I was very grateful for, which was the fact that I had the AMN community of trainers and therapists at my disposal, which a lot of people obviously don't have. So I was very, very grateful for that. And for the level of knowledge that I've accumulated over the years, was able to kind of design my own programs and things when I was kind of let down again with the level of care that I was given. Not that, not to the surgical care and the care I got at the kind of acute level was fantastic. It was the post-surgical follow-up, which was disappointing with the physiotherapy and stuff, which I'll talk about in a little bit. But yeah, I understand why the surgeons have to manage your expectations. And I understand that they're looking at things from a purely statistical model. Like they're looking at, like when an injury like this occurs, the likelihood of returning to full normality is low based on the statistics. So, it's their job to tell you this. So I'm not criticizing the fact that that's what, they said, look, this is the reality of your situation. But it can be very, depressing, obviously, when you're told that you may never be able to use that knee the way that you did before, especially when you're active, like when you're a very active person and likes to do things like skateboarding and snowboarding and things like that. And I also think that what it can tend to do is install these kind of limiting limiting beliefs around what you're going to be capable of when it comes to rehabilitation. And I think if, obviously, and we can, maybe you can dive into this a little bit more detail, but, your beliefs and what you think is going to have a massive effect on your physicality, on what you're actually capable of. If your brain, if you're telling yourself these things that, I'm going to have a limp for the rest of my life. I'm not going to be able to kind of do impact sports or do dynamic stuff ever again. Not only is that kind of depressing and psychologically it's tough. I think it also gets in the way of being able to rehabilitate properly. And, from multiple different angles, I think part of it is you start to make excuses for yourself. Like you start to go, well, it's fine. I don't need to push it. There's no point anyway. But then there is also that neurological connection of like, when you have these limiting beliefs, that becomes like a self-fulfilling prophecy, right? You're saying, well, I'm never going to move this joint again. And the more you believe that, the more that becomes reality, right?
Yeah, 100%. I mean, I think at the end of the day, as you said, a statistical model is fantastic. It is something that obviously we require in that, especially within that part of the health system. It is incapable of taking into account the individual, by its very design. And you're right. I mean, your perceptions, our perceptions are our reality. And along with that, there comes a chemistry. That chemistry can become repetitively utilized, with more of a stress orientated chemistry in the body. That's obviously going to have an impact across how the entire system functions in terms of the autonomically, in terms of peripherally as well. We have to accept that it is a two-way street. I mean, we have to understand that there can be a level of damage to the body that, at the end of the day, if you damage the meat and potatoes bad enough, there may not be any way back to where you were at before. But within that, we need to also accept that how we perceive the entire process and what your starting point is in this as well. Like your perception prior to having this injury, as you've said, you were more optimistic. You have a history of meditation, regular practice of meditation, and regular practice of gratitude and these kind of things. That sets you up in the first place to have a perception in which you feel like, okay, I'm going to succeed through this thing. And then when you are faced with some adversity, as I say, when you take into account the two-way street here, what's happened to the body, what are your capabilities to heal, what healing capability is available, what help do you have on hand? You've had a lot of help available. You put all these things together, that's building a perception that you are going to succeed through this, which you are doing, and you are far exceeding the expectations of the surgeons and the therapists you originally spoke to. So yeah, absolutely, how we perceive everything and anything is everything and anything. So absolutely, that's a big part of it. Now, I remember you just touched on the fact that you said you had a large community of people available to you. In that first 4 weeks, you were immobilized, as you said. There was, we were communicating. It was depressing for you. There was the atrophy. I'd argue you could afford the atrophy in your quad. There was a couple of things that we started to do. I was, we there's distance between us now. You are in Latvia, I'm in the UK. There's a global pandemic. So there's a limitation to how much hands-on sort of therapy, inverted commas, treatment, whatever we could do, as in zero. But there was a couple of things that crept into your world that I know it was the first time you'd experienced. And I want to just touch on the first one, which was relative to the community, which was something that occurred completely off the back of some of our practitioners, where they wanted to do essentially a group-based intention to see if they could help you. And these are people, disparate parts of the world, all over the place, all coming together to focus essentially their attention, their mental energy, where they focus their energy, and ultimately where they drive their intention, which we can discuss, but in my intention is the direction of conscious energy, to see if they could help you, see if you could be aided at all. And you were, to a degree, blind to this process. Is that right? Or,
So I had no idea. So let me preface that by saying that this side of thing is not my area of expertise at all. I have very little knowledge in relation to this kind of stuff compared to the very biomechanical, mechanical side of things. Like I've got a lot of knowledge when it comes to that. When it comes to the energy side of things and the intention side of things, regardless of the fact that I am co-founder of this company with you, and the AMN has a lot of this within its wheelhouse now, it sort of diverged at a certain point. And, now that I'm very much in charge of running all of the operational side of stuff, my knowledge and my education sort of stopped at around kind of the level 2 certification with AMN. Beyond that, I just didn't have the time to absorb the information. So I just don't, it's not my wheelhouse, and I don't know that much about it. And
can also just make the point there also that you as well, you are completely open-minded to all of this stuff being possible and something that's out there and useful, but to a degree, I think it's fair to say it makes you a little uncomfortable.
It makes me uncomfortable. It does definitely make me uncomfortable.
That's the same for a lot of people. A lot of people out there. And there's a slight quick story to this, if I may just chuck it in there, because it always springs to mind. We were doing one of our
Bali
retreats. Mastermind retreat in Bali. Luke had been away doing some, whatever, adminning, we had to do procedural stuff. And I'd been in a room with all of the practitioners, and we'd been doing a kind of, it was more of an energy-based session where we're working with intention, and there's some group kind of intention going on. And we would, it was a really cool experiential thing, but Luke, there was a lot of emotions flying around the room at that time. Luke walked into the room, took one look around, just went, "Not my room," and left immediately. So obviously, element of this stuff that does make you uncomfortable, and it used to make me uncomfortable, and there's a lot of people out there in the industry, it would still be that way, whereas I think this stuff's become more and more accepted all the time. But
I think a few people had sort of had some breakthroughs, and there was some crying and some hugging going on, and I'm not that person, so I walked in and sort of saw it and turned around. I was like, nope, and just turned around and walked back out. So to say that this stuff, when we talk about this kind of stuff, makes me uncomfortable a little bit, is pretty accurate. And I would say that, I'm very open-minded. I will consider anything, but I'm very slow to draw conclusions on things. So it's, I would say that I'm a healthy skeptic. I have a healthy skepticism of pretty much everything. So basically, unbeknownst to me, there was a group of very high-level AMN practitioners. I'm not sure who organized it. I think it was probably Hannah Moody. But very amazingly, kindly sort of organized a group of the practitioners to kind of get together and do this group kind of energy-based intention treatment from a distance, the kind of thing that makes me quite uncomfortable. But so I had no idea and that it was going on, and I had not been able to sleep since the surgery, or since the injury, because of the fact I don't sleep very well on my back, and I couldn't sleep in any other position, and I had been getting maybe 3 or 4 hours sleep a night, which obviously is not great from any perspective, psychologically, emotionally. Physically, you're not going to repair, you're not going to heal as well if you're getting such little sleep. I was quite depressed. I was just feeling sorry for myself in general, and I think it was probably, I can't remember when it was exactly, but it was at the time that they were organizing, and I found out kind of after the fact that they had done this treatment, and I was probably just before bedtime one night, and I just randomly kind of burst into tears, and I was by myself, but it was really weird because I don't cry. Like I'm not a crier. I'm not an overly emotional person. I'm fairly even keel. And I think I joked to you, I was like, I haven't cried since the mid 90s, I told you about it. But, it was really weird. It was very, very weird for me to sort of just randomly burst into tears like that. And not only that, I slept that was the first night that I had slept since it had happened. And I think this was probably, by this point, probably 6 weeks or something after the injury. And then I found out, I think about 3 or 4 days later, you mentioned that some of the practitioners had banded together to do one of these sessions. And then I spoke to Hannah and found out when it was. And she said, I was just looking back through the messages. So 9:30 p.m. they had caught up on September the 18th or the 17th. And at 9:45 p.m. UK time. So 11:45 p.m. my time was when I had this kind of breakdown moment, and then fell asleep straight afterwards. So it's very, very coincidental that I had this kind of treatment that I was unaware of, had this response, and then felt amazing afterwards and slept finally. So yeah, it was a weird one for me.
Yeah, I think that's also this is what makes this story and this process you've been going through and are continuing to go through just so interesting, because it's been, there's, as I've described, there's been a real solid, intense meat and potatoes in injury here, like a tearing of the stuff that holds you together. That's very kind of macroscopic scale. You can touch it, feel it. It's snapped in two. You've been put back together by the incredible skill of surgeons and experience of surgeons doing a job on something that's exploded, which in itself is amazing. Yeah. But then you're getting benefit from things on a much finer scale in terms of a much higher density of energy and much finer scale. That's kind of how I think about these things when we think about subtle energy and use of intention and that sort of stuff. And it was shortly after that I felt it'd be appropriate for me to come in and start trying to help things a little bit. And again, this was done remotely. And, this is global pandemic has seen my business with clients shift exclusively to working remotely online. I have a video call. The client's on the other end of the video call. We've had a discussion. We've had a history. I've made my notes. And then essentially I apply the Amen system entirely in that capacity. I sit and I assess, and I have a self-assessed biofeedback marker where I'm muscle testing. I'm gaining information via essentially a process of statements and attention and thought, where I'm running through screens and seeing where the body has its, where the body needs the help. And then when I have that information, either the client is going to be providing, we use piezoelectricity, so the client might be tapping on the body somewhere. I'm focusing my attention on the findings, or I may be, inverted commas, utilizing healing, which is something that I never, ever in a month of Sundays thought would be something that I would be doing. But it's something that's evolved for me recently through various practice, whatever. And this is what I did. I applied the thing that your system showed me it needed at that moment in time while I'm sat in the UK and you're sat in Latvia. And we were able to make some really marked improvements.
Yeah. So once I got out of the like the splint thing that they put your leg in that restricts the joint, so you can't bend it, I obviously had a lot of atrophy, and then I also had inhibition. I had an inability to contract the quads volitionally, and so through kind of digging into why that was, because I wasn't given any of the information kind of by the surgeon or anything like that, because they don't know my background. They're not going to talk to me about muscular inhibition caused by swelling in the joint and all that kind of stuff. They're just kind of going to go, all right, you're repaired. I've done the surgery. My job's done. Now it's time to go to the physiotherapist and work on getting this back to as normal as possible. So unfortunately, I mean, it's a lot to do with where I am, not to bag Latvia at all, but the level of education here is in terms of physical therapy is just not up to scratch. It's not up to par with, a lot of the other, if I was in America or Canada or Australia, or the UK, it probably would have been different. But so I went to see the physiotherapist and had a really bad 2 kind of appointments. The first one, he kind of just moved my knee. I'd literally just taken the splint off in front of him and had not moved the knee in 4 weeks. And he was going around measuring the calves and the quads and just sort of getting a baseline of atrophy and stuff, and just kind of like moved my knee, which was excruciatingly painful and surprising at the same time. Sort of that I haven't moved this in months, and you get this kind of sympathetic reaction where you tighten up and everything's, you kind of have that panic and your heart rate goes and all that kind of stuff. It's very unpleasant. And I swore as I do, possibly at him. I can't quite remember, but sorry, I forgot. I got quite annoyed. So, well, you forgot about the thing that I'm here to see you about. Okay, that's great. And then the follow-up session, he put me in one of those kind of machines that moves for you, and you have like a little thing where you can increase the range of motion. You're in control of it. And then after that, we were doing some exercises, and he kind of just put the knee over like a foam roller and said, okay, extend. I was like, I can't extend. I've got no control over the muscles. I trying my best, but I cannot extend my knee. I couldn't do it to save my life. And he was like, okay. And then takes me over to a leg extension machine, which I'm sort of looking at apprehensively. And but it sort of doubled as a hamstring curl machine as well. So I figured he's going to start doing some hamstring work, which I could do at the time. So I was like, okay, I can control the hamstrings, but I can't control the quads. Maybe he's just going to pop me on there and I'll start doing a little bit of hamstring stuff, isometric or whatever. Anyway, so get my legs up on it. It's the supports underneath my Achilles, so it's the back of my leg. And then he just grabs the pin and moves the thing. So my legs are out in front of me, and obviously I've got no control over my left leg. So it just swings down and just sort of flops, and which again was excruciating painful. At that point, that was kind of like, I think I called him a monkey in a tracksuit, and left. I have a way with
one of the funniest text messages I think I've ever received. To be fair, I mean, it was hilarious from my end, probably not so much fun for you. But I do remember that entire part of your experience, let's say. And it's kind of, you've said it there straight away. You've been asked to do something that you just physically couldn't do. Contract. I can't do that.
Yeah,
and I think sometimes it may have been construed that you weren't trying.
Yeah.
Come on, try harder, man. But it really wasn't like that. There was complete inhibition.
Yeah.
You could not contract the musculature. Yeah. And that's something we needed to start to try and work on. Exactly. And you also mentioned the inflammation here. So
there was a lot. Yeah, there was a lot of inflammation in the joint. There still is to this day. And that's something that from the research that I've been able to dig up and from speaking to the surgeon is probably going to be something that I'm going to be dealing with for a couple of years, is just, when there's use of the joint, it's going to start to swell up, which, I want that to happen, because that's bringing in all of the white blood cells and all of the nutrients and everything to repair and to make sure everything's fine. But I also dug up some research that showed if there is any inflammation in the joint, there is a presynaptic, so at the spinal cord level, there's inhibition that is introduced in the quads. Like they did it artificially, where they were injecting healthy adults with saline and glucose into the knee joint, and there was a 30% reduction immediately in their ability to contract the quadriceps once there was fluid in the joint. And then obviously they would move the joint, submaximal contraction of the quadriceps, which obviously stimulates the lymphatic system to drain that fluid out. And it came back to, the pre-injection levels within a few minutes. So there was a very strong case to be made that any inflammation in the joint has this kind of inhibitory effect, and you can sort of see why evolutionarily like that would occur, because you're wanting, it's the body's trying to prevent you from further damaging that joint by not allowing you to move that joint, by shutting down the muscles in control of moving that joint. But it does make it difficult to rehabilitate, to build that muscle back up, to get the inflammation out. Like, inflammation is something that you want, but you also want it to flush it out. You want it to sort of fill up and empty and fill up and empty continually. So it sort of, takes the crap out with it, and then, brings all of the necessary nutrients and everything to the tissues. So it was a big hurdle for me. I could not extend my knee. And so by not being able to extend my knee, I was really struggling to rehabilitate the joint. And it was, I think 6 weeks or 7 weeks post injury, I still had no control whatsoever of extension. I could do some flexion within the mobility, the range of motion that I had available, which wasn't much to begin with, but I had zero ability to extend the knee at all. So that was a big hurdle, and it was one that was really psychologically getting to me as well. I was getting very frustrated by not being able to not having control of my body. I was feeling like the body was letting me down. I was like, just move. You belong to me. Move, damn you, and it just wouldn't move. And it was really frustrating. And that's when the first time that I got extension was the first kind of treatment that we had, where we were doing the one-on-one distance treatment. And that was, I got 6 reps from about 25, 30 degrees. So I was sitting at a desk much like this. And at that point I couldn't put my foot on the ground. I didn't have enough flexion. So I'd have my leg kind of propped up on a cushion that I had under the desk. I said to work. So I would have it there, and it was sort of bent at around 25 or 30 degrees. And we did sort of some pre-assessment where I would try and contract. And at this point I'd be doing a few other things that I'll talk about in a minute, and had gotten some amount of muscular contraction back, but not enough to extend the knee. And the VMO specifically was just not there. It just had no ability to contract at all. So I was able to go from nothing to six reps from about 25, 30 degrees to 0 or close enough to 0 degrees, and back, I think 2 or 3 times, and then kind of lost it again. But that was a big turning point in the ability to sort of, the range of motion started to come back much quicker once I was able to move it like that. And then once the range of motion came back, then you had this kind of knock-on effect of being able to do more. So therefore you were able to do more. You know what I mean?
Yeah, absolutely. I think, this is something that would point we want to get across to people who are doing, AMN practitioners, where, we're assessing for very specific levels of dysfunction within the peripheral nervous system, central nervous system, and beyond. Whether you're whatever neuromuscular therapy or approach you may have at your disposal, we're describing this. There was this vicious cycle initially, right, where inflammation, we need it, but it's bad. We need it, but it's bad. It causes inhibition. We need it, but it's bad, et cetera, et cetera. And you've got to be able to, there has to be a point where you can break that and work to a certain tolerance where it kicks back in, and then the tolerance is going to gradually move outwards and outwards and outwards. You can have a larger scope of movement gradually. So when you're applying the approaches that you have to reset the neuromuscular system, to reset the peripheral nervous system, to reset elements of the central nervous system, and you get change in a session, and then the client reports back, yeah, it's swollen again, or maybe there's some pain again, and the range of motion was great, but it's reduced. That's okay, and that's normal, and that's part of the process. And it's a case of gradually moving that outward. So you have, it just over time, you're just basically improving the situation. It was what I did remotely, which again was the first time you've ever experienced. I remember I was doing some, directing. Essentially, I was focusing on, one of the things I was doing at the time was the capacity to heal at the time I had was the projection of light, the focus of my attention and intention of light in certain areas of your body. I know we took bruising down in the session. I know pain went away. I know it was the first time you'd felt your quads firing, especially the VMO at certain at all in session, and you could feel it happening while I was focusing my attention and being all weird. And then we reset some of the neuromuscular apparatus, and it gave you
Yeah.
Just that sense of like, oh, I can feel the leg, I can move it. And even just that gives you that little boost, doesn't it? To know that, okay, there's hope here, we can keep moving forward. And so what have you done? You know, we've touched on this, working on this very fine scale of intention and you know, high density of energy and working with the body, even though it's had this severe damage to it, which seems very biomechanical and very on the surface, and I can see that, and it's broken, but yet we can work way underneath the surface of that to aid it. What have you been doing in terms of rehabilitation? I know you've been working on some nervous system hacks and ways to get around the continuation of that healing.
Yeah, so one of the biggest issues obviously is sort of reduction in proprioception. So my ability to sense the joint, part of that probably came from, you know, the injury, well, not probably, part of that came from the injury. And then part of that came from also being immobilized for so long. You know, had it just been, as the surgeon said, had it just been one of the three things by itself, he would have had me moving much earlier, like after sort of 2 weeks at the most. But because it was all three together, and there was, you know, just a complete lack of stability around the joint, there was nothing really supporting left. It was all damaged. So I had to wait for the healing, you know, for the tissue to actually heal enough. So yeah, part of it was being locked up in that cast or the splint thing for 4 weeks. So there was just a lack of movement. So therefore the proprioception, you know, the proprioception was down. But yeah, so one of them, the difficulty with that was that I couldn't feel the joints. So like there was a lot of numbness on the surface, on the skin. And there still is, it's a lot better, but there's still areas of numbness. And that's sort of, I had the same thing. And I think most people who've had surgery will tell you they've had the same, they feel the same thing after the surgery. When I had the Achilles, it was numb for a while after that as well. But yeah, just sort of increasing proprioception around the joint has been one of the big goals. And then increasing the muscle mass around in the quads, which is still an ongoing process, which has sort of been hindered by the fact that COVID has all the gyms locked down, and kind of limited to walking at the moment in terms of sub-maximal effort over time, which is what I should be really focused on. So cycling and things on a cross trainer or something like that, but I don't have the ability to do that at the moment, unfortunately. But so I after deciding not to go back to the monkey in a tracksuit, I developed my own I designed my own rehab routine. So basically what I was doing was using compression. So I was using the voodoo bands with the rock tape. Probably should say no affiliation. It's not a paid presentation or a paid endorsement. It's just what I used. But it was
elastic are available.
Yeah, exactly. So I just had the elastic band. I think you can use TheraBands as well, but I used the voodoo one because it was the right kind of thickness and stretchiness. And I would basically strap up the joint to create compression, with the goal to basically flush out the joint. I wanted to get the swelling out and clean it out, and then just allow the swelling to come back and not be worried about the swelling to come back. But I wanted to have that process of sort of emptying the joint, letting it refill, emptying the joint, letting it refill. And at first, because I only had such small range of motion and it was touch and go, some days I would have it after the treatment that we did, and some days I wouldn't. And so what I would use is like a TENS machine, but it's like an EMS. It's a different frequency, I believe. Don't know that much about it, but I would hook that up to the quads and isometrically contract whilst also contracting the other side. So my right side, the uninjured side, as the electrodes were stimulating the muscle, I was volitionally controlling. So at first, it was actually just imagining that I was controlling the muscle. So it was kind of like guided motor imagery. I was imagining that the muscles were contracting, or they were contracting. I was imagining that I had control over the contraction, which I didn't. But then also contracting the other side, which I did have control over. And so that helped kind of rebuild that connection neurologically. And then after speaking to Dr. John Campione, who is a level 3 AMN practitioner and a physical therapist and a chiropractor and a lecturer at Illinois University in physical therapy. So very, very knowledgeable guy. And I think we're going to try and get him to join us for an episode where we talk about sort of post-injury rehab as well on the podcast. But after speaking with him, he had some other great little bits and pieces. So movement-wise, I started off with isometrics. Then once I could, it was just straight up flexion and extension. I would do that initially not under load. So what I mean is, like, what they would try and get me to do at the physical therapy clinic at first was lie on my back and then with something underneath the knee and extend the knee from there, which at that time was just too much load. Just even from the knee to the ankle, whatever muscle mass was there and bone mass and everything, it was just too much. It was too heavy. So I would start by standing up. I'd stand and I would put my left leg slightly in front of me and bend the knee and then extend the knee there. So the load was less. It was less gravity to fight against. And I sort of regressed it that way. Whilst being strapped up with the voodoo band. And then I also would have the EMS machine on the muscles. So I progressed from isometric contraction, basically on my couch with the other side contracting, to regressing the extension movement by standing up, still using the EMS machine to stimulate the muscle, especially around the VMO, because I was getting other muscles involved, but the VMO still was hit and miss. And then progressed it to lying supine, so adding to the load, making it a little heavier. And then I would put my leg up on the wall and slide my leg, just put like a sock on or a piece of paper in between my foot and the wall, and just look at sort of sliding the leg through flexion and extension at the knee to reduce the load a little bit that way as well. So I was just doing a few things to just try and regress the movement. Now I've progressed up to like standing on one leg with the knee bent while I do things like brush my teeth, just to increase the kind of proprioception through there. And lateral lunges, squats, you're squatting up and down off the couch, all without weight other than body weight, which is not considerable. So it was, and then Dr. Campione sort of mentioned that I should throw in some vibration as well, which could be really useful. So using one of those Theraguns that with a soft attachment on the end around the joint, just increasing proprioception prior to doing any movement stuff, and then in between sets as well. I tried doing it whilst moving. It was just too sort of difficult, cumbersome to juggle everything, but that's all helped massively as well. So just increasing the awareness of the joint, and also some skin stimulation. So using a rough towel just over the surgical site, over the scar tissue, because there's no numbness left inside the joint, but there is numbness on the skin still. So I've gotten most of the internal proprioception back, but I'm still having sort of issues with proprioception on the skin. So using some kind of rough implement tool or a brush or something like that over the skin in between sets of movement as well.
I mean, there's a lot of information there. So that's, it's great you're having so much success. Some of the things you've mentioned there, just in a little more detail, immobilization of a joint over time is going to cause a local acidosis, oxidative stress, a local hypoxia to the tissues. You're going to get this disturbance of cutaneous nerves, of other peripheral nerves, motor and sensory. You're going to get a non-neurological disadvantage there within the extracellular matrix as well. You're going to get a buildup of what's termed hyaluronan, which is a glycosamine. The glycan is supposed to make the fascia slide over itself fluidly, and when things don't move for a long period of time, you can get build up of stiffness because you can get an excess of this stuff, and all the tissues become a bit gluey and a bit sticky. You've mentioned using visualization. Guided motor images is another way to describe it, kind of specifically how you're doing it. Now, whenever we visualize successfully, we tend to slow the oscillation of the brain down from a faster state, usually up in a beta state, normal kind of awake thinking, kicking about, going around your day, to a slower frequency down 7.83, 7.84 hertz into the alpha state. That's when visualization starts to really kick in. And the further deeper you get into those visualizations, and the more maybe complex, or the more you get lost in them, the brain slows down even more. You get down to this alpha theta border. And one of the things that happens when we hit alpha is that we inhibit those beta states. And if you've been in a more highly stressed state, maybe there's been pain, you're a bit more sympathetic, you're a bit more fight or flight kind of state. When you start to visualize and process things and the brain slows down, you get this physiological net parasympathetic effect, and that's something that can aid in the general process. But the other great thing about guided motor imagery is the fact that the brain is firing the motor system in exactly the same way as if you were actually moving. But the great benefit of it is that you're not getting any of the nociception back. You're not getting the sensory feedback that would further inhibit the system. So visualization is hugely important, hugely beneficial. And it's something you've seen over time, gradually been improving the situation, also doing things in standing whenever you can.
Yeah.
Your proprioceptive system is integrated with your vestibular system, being the inner ear and how you balance. When you stand upright, those systems get to fire together as opposed to being in supine or seated postures. But obviously that's within reason. When you can bring this stuff in, it's important to know you need to get upright as best you can.
Yeah.
You mentioned flushing, use of occlusion, and there's a hormonal cascade which occurs with that also. A lot of really, really useful information there on how you've been working your way through this process. And why don't we just wrap this one up now with where you're at now, how you feel about the progress you've made, and the fact that you are essentially not walking with a limp that was apparently guaranteed? Yeah.
So the prognosis that I was given was that it was probably going to take between sort of 9 and 12 months for a full recovery. As full a recovery as I was going to get, with the thing that sort of said you will more than likely have a permanent limp, which I was determined not to have. Who wants to be permanently limp?
With a for you as well, so it's good that you managed to get past that.
Yeah, so it is my personality as well to just be like, no, that's not going to happen. I'm not accepting that. So I am. It's now about 3 months post surgery. Post injury. I mean, they're only a couple of days apart, injury and surgery, so it's one and the same. But I think it's about 3 months. I've lost track. It's 12 or 13 weeks. So post surgery. So I have no limp, which was huge. That was one of my big goals. So I can walk. The gait is there's no noticeable difference visually. I can feel the difference. I can still feel a weakness on the left side. But that still has to do with the fact that there is some atrophy to be addressed still on that side. As we all know, anyone who's tried to do any kind of hypertrophy training takes about a month to lose and about 3 months to rebuild, or to build up. So, and then the fact that I'm kind of limited in what I can do at the moment with all the gyms being closed and stuff. So it's I can do body weight stuff, but I can't, I can't get on a bike for 45 minutes or something, which would really accelerate the results. I can walk upstairs without sort of leaning or anything, which I was kind of told may not happen. I can almost walk downstairs without any assistance from holding the railing or anything, which is a new kind of milestone as well. So upstairs became fairly quickly. Downstairs was more of an issue because sort of the mechanics of the way that the knee bends and carries load when you're kind of walking downstairs. Anybody who's done any kind of reverse drags or something will know it's just a different animal. So that's a new progression, which is great. I have a ways to go. I still don't have full range of motion back, but it's pretty close. It's, I would say, only maybe 5 or 6 degrees off being able to bend the same as the other knee. Load bearing with inflection is still got a long way to go. That's the kind of the last hurdle for me is, being able to kind of squat deep, or being able to kind of, I can't remember what they call the squats where you're up on the balls of your feet, just sort of that resting position where you can just kind of squat down or get onto the ground. And it feels weird as hell if I'm on my knees. So if I'm on the ground on a yoga mat or something, and both of my knees are on the ground, whether I'm upright or on all fours, the proprioceptive difference between one side and the other is bizarre. Like, it just feels like it's a different leg, like they're different lengths. And so there's still all that kind of stuff going on. But in terms of prognosis, expected results and achieved results is very, very promising. I'm hoping that I'll be able to skateboard again, that I'll be able to go snowboarding and do all that kind of stuff. We'll see. I'm not going to rule it out, but I'm also going to be as realistic as possible. But I think in terms of the expectations, the surgeon's thrilled. Of course, he's taking full credit for it. It's cool. He did a great job. It's well and above exceeding any of the kind of expectations that were outlaid at the beginning of this whole process.
Well, congratulations on that, man. It is good to see, in comparison to those text exchanges we had when you did this right at the start, and you were pretty low with this whole thing. It was obvious how severe this was, and it's great to see what a recovery you have made. And the fact, I think it's an interesting story. One of the take homes from this, I think, is that the body is, regardless of what happens to the body, whether it's this massive structural injury or whether it's an emotional problem that someone's suffering, you are always a completely integrated system that functions on so many levels across multiple scales. And I think you're literally a non-limping, now walking example of that. The fact that your system has benefited from interventions across multiple scales, and it's been really a multi-modal kind of approach to bring you to this point. It has to be, absolutely, it has to be. So we can't rule things out.
Exactly.
We can't rule things out.
Focus on one thing.
Absolutely. It makes no sense. The body does not work like that. It doesn't. It is not just biomechanical. It is not just neurological. It's a combination of multiple. It's energetic. It is subtle. It is meat and potatoes. It's all of these things all together all the time.
Yeah.
And we have to be able to just touch on the right element at the right time to give it what it needs to reintegrate, as with whatever's dysfunctional, so you can improve and heal the best you can. And overarching that entire process is your own perceptions and intention. And when you put all of this stuff together, you can get really dramatic, positive, beneficial changes. So hopefully this serves as gives some good practical advice to people, hopefully inspirational for some people who may have suffered similar things. And there'll be more to the story, so we'll keep in touch.
Yeah, exactly. So it's still got a ways to go. And I think I was speaking to Dr. Campione about the more kind of rehabilitative side of things, and seeing if he can jump on an episode with the two of us, and we can just chat more about the you know, the nuts and bolts of the mechanical side of things. Because I think that's where, you know, obviously with the AMN side of things and the energetic side of things, you know, people can reach out to us and AMN practitioners to find out more about that. But with the mechanical side of things, there is a distinct lack of information available. And I think if people are physical therapists, physiotherapists, personal trainers, and this information of like increasing proprioception through vibration, if any of the stuff that we mentioned that is kind of new, something that they haven't heard of or they haven't heard much of about, it's definitely worth finding out more about that, if that is a service that people are offering, if they're helping people post-surgical rehabilitation. These are all things that should be part of their toolkit that they're throwing at their patients. So we dived a little bit kind of more into that with John, hopefully in the near future.
All right, good stuff. Well, you take care, man.
All right, mate. Catch you later.